Hello, everybody, and welcome back to CCA's Medical Minute, sponsored by Kroger Health. And we are thrilled today to be here with Dr. Marc Watkins, actually, Chief Medical Officer for Kroger Health and our partner as well. Mm-hmm. He just zipped in here from Dayton, Ohio, and God only knows where he's headed next, but I'm sure he's somewhere busy. He's busy, we know that. So anyway, Dr. Watkins, I think you've been Chief Medical Officer for Kroger Health for about 5 years now, but you were with Little Clinic before that,
correct?
Right?
Yeah. So for a total of 8.5 years,
Okay.
so it'll be 9 years in the spring, Steve.
Gotcha. What's a typical day look like?
Depends on the day, right?
Yeah.
It's kind of like my golf game. Kind of depends on depends on the day. It depends on the day, and I think typically, and I say this to our teams all the time. I only exist in my role and my capacity because of our patients and then our associates. Okay. And there's really not a reason for me to exist and providing support and leadership. It's really about helping those on the front line, giving them the tools they need to be successful, really clearing obstacles and roadblocks, ensuring that they have a good day. And if you think about that in terms of what our frontline associates do every day for our customers, it's so that they can pay that forward to the customers and continue to grow loyalty.
Gotcha.
Dr. Watkins, you guys just had a very successful wellness festival, Kroger and Kroger Health, and I mean people from everywhere, and that's a part now of the Kroger experience, if you will. Well, it's becoming vastly a one-stop shop for wellness. Kroger Health, the little clinics, and the 2,200 pharmacies across the country. Is there anything new coming down the line that can complement those things as well?
Thank you, and Sherry again, and Steve, thank you for having me. And what a wonderful privilege to be able to be part of that wellness event. And thank you for your time. We shared a panel together and shared some great thoughts. But we had over 250,000 people over 2 days. And special thanks to our sponsors, presenting sponsors, those who brought that to life. But it was really about an opportunity to, as I mentioned a little bit earlier, pay it forward. Really thinking about giving people an opportunity and a little bit of a window into the fact that we're really about helping people live healthier lives, and how can we then curate opportunities to help them understand what are some of the new things out there that can help them live healthier lives, and to that end, what is coming down the road in terms of us doing some things new. I think let's just take a step back and talk about what happened during the pandemic. Those pharmacists and nurse practitioners and physician assistants really were on the front line giving vaccines and helping us to get through this pandemic. And there were a lot of ways that we got through the pandemic, but there's probably none more important than our way, the vaccinations that we were able to provide. So Kroger Health provided a little more than almost 14 million COVID vaccines during that period. I only bring that up to say we would not be where we are today without them. So special thanks to all of those clinicians. Probably what's coming down the pike that's super exciting for me is what we're doing around food as medicine. How do we further elevate that cause, right, from just what we heard from our moms and our grandmoms, right, that you are what you eat.
Right.
Yeah. And how do we then really begin to transform the delivery of healthcare through the lens of food, and thinking about how can you be the best version of yourself by understanding what are the healthy foods for me. And I can get into some detail, but we launched an opportunity to provide medically tailored meals at scale. So that's a new program that we've launched where folks who may have a clinical diagnosis, let's think about someone with diabetes, or think about someone with heart disease. Can they get a specially designed meal that's ready to eat, has all of the ingredients, all the nutrients, the macronutrients, especially the micronutrients that are really healthy for them, so that they can really take control of their disease condition. And we believe that could really offset healthcare costs down the line, but more importantly, help that individual be the best version of themselves.
How close is that? How close are we to that?
We have launched it, and we're rolling at the moment.
That's fair. But so when you say meals ready to eat, though, I mean, are you giving recipes, or you actually
a combination of both, Steve?
Okay.
And I think what's important here are these are dietitian curated medically tailored meals. These are meals that are prescribed by your clinician. So think about a physician, a nurse practitioner, a physician assistant, actually writing out a script for this because you qualify for this meal just like you would a prescription at a pharmacy. So, and I'm saying this because we understand that you sometimes eat more than 3 times a day. You might take your medication 1 time a day.
Yeah.
But if you have an opportunity to have a meal that's healthy, nutritious, and it helps you keep your blood pressure in control because it's not loaded with a bunch of salt and sodium, that makes a huge difference for patients. Huge difference.
Salt. I know Sherry helps keep me healthy.
Yeah.
Someone's got to watch you, Steve.
I've got to watch
she-
to make sure he's not going overboard there. Well, statistically, since you were talking about the food as medicine, statistically, it's lower income communities that have a much higher cancer rate. And so you spoke to things that, might work with the heart patient, might work with the diabetic patient. What about the cancer patient? Anything that they would be able to tap into as well with the food is medicine and the program that you're bringing
absolutely.
forward?
And thank you for your question, Sherry. Unfortunately, we've seen not only cancer, but almost a myriad of diseases impact socially marginalized communities over millennia. So it's nothing new. Unfortunately, that is something that we are keenly aware of and understand that there are a couple things at play. And maybe I'll answer this a little bit different. When we think about cancer and some of the risk factors for cancer, sort of what comes to mind, a lot of people say, well, it could be smoking, what can it be? But right now, the number one modifiable risk factor for about 13 different cancer types is obesity. So we know those who are suffering from obesity, suffering from being overweight, and we know that population of socially marginalized communities over-indexes for things like obesity and being overweight. So when we think about solutions like food as medicine, I'm primarily talking about addressing nutrition security in that population by giving them the right foods to eat the right time. So if we think about the rising risk of cancer in that population or chronic disease, a thoughtful solution around food creates an opportunity for these communities to have an opportunity to reduce their total cancer risk, but also the risk for the risk for other chronic diseases as well.
Question for you on vaccinations. And we just did, it was just a couple weeks ago, I think we did something, but I wanted to do just maybe a little bit of a refresher, but particularly within the context of what Kroger can provide and how easily it can be provided. Now, I've been a good boy. I've already, I've had my RSV and I had my COVID booster last week. I need to get my flu shot, which I hope to do maybe even as early as this weekend. But, is it as simple as just kind of, can you just walk in off the street? Do you need to make an appointment? What's the typical cost for something like that? How does that work at Kroger?
So it's whatever suits you, Steve. So appreciate the question. If you want to walk in and talk to one of our pharmacists or nurse practitioners or clinicians, you can easily do that.
Okay.
If you want to schedule something at Kroger.com/vaccinations, you can do that as well. You can have an appointment in hand. So before you leave the office today, you can schedule your appointment at your favorite Kroger.
Okay.
And you can actually have a time and a date set that when you want your appointment. So, and I'm really proud that you got those couple of shots. And for your listening audience and those that are watching, think about making sure you get your flu vaccination before Halloween for sure.
Yeah. Okay. I was going to ask you about the timing.
And then finally, you mentioned about cost. And so most health plans do cover preventive services. So that's timely you mentioned this. And vaccines are seen as preventive services, much like screenings. So when we talk about removing the friction for patients in order for them to access healthcare services, preventive screenings like a mammogram, a colonoscopy, a screening colonoscopy are covered services, just like vaccines. So no out-of-pocket costs for most plans.
What are you seeing? I sometimes feel for folks that are in pharmacies, like in the settings that you guys are in, because there's so much they have to do. I mean, you think back.
Right.
I think back to when I was growing up. A vaccination was something you got when you went to your doctor. Well, now not only is that part of maybe a shopping trip, But people's expectations are they want it right now. They don't want to stand in line very long. They don't want to wait very long. And I think about what all these pharmacists have to do, and you hear reports now about burnout and things like that where they're just running so hard. Are you seeing that as well? And I mean, are you kind of trying to mitigate that a little bit with your staff and try to work around that?
Well, absolutely. It's hard not to see that, right?
Yeah.
And we're very privileged to be at that on the front lines of being able to provide healthcare into the communities that we serve. And we have a little bit more than 24,000 associates that represent Kroger Health. And about over 500,000 on the Kroger side. So these associates have been on the front lines even before the pandemic. And if we're not addressing things like burnout, workload capacity, making sure they have the right levels of staffing, and that's very, very important. So how do we, one specific tactic is how do we allow and create enough time in the workflows in order to have the pharmacists spend more time face-to-face with their patients.
Gotcha.
That's clinical value, right? That's clinical add to that. And then how do we maybe reduce the amount of incoming phone calls to the pharmacy? How do we automate some of that? How do we create opportunities for them to take strategic breaks through the day?
Yeah.
And then get the right amount of training that they need to continue to practice at the top of their license.
So Dr. Watkins, is almost as if the little clinics and the pharmacies now, it's becoming its own kind of almost hospital type entity. From a public health point of view, do you all worry that more people will become so reliant on your services there that they may not schedule those appointments they need with their PCPs or maybe those specialists, or will the pharmacists in the little clinicians redirect them back to those sources?
Sherry, great question. And one of the things that we ask almost every visit and almost every time that we're privileged to engage with a patient that trusts us with their care is we ask them who their PCP is. Who is your primary care provider? And we make sure we want to document that on the chart, because guess what? We want to share that information upstream with that clinician, with that primary care physician or specialist. And you said something, will we ever become a hospital? And let me answer that. That is a no. And to make sure this mic is working, that is a no. So we are 100% committed to not fragmenting healthcare for patients. And that means where that information doesn't flow back into, whether it's a registry, something back to their primary care provider or specialist when they allow us to do so they consent us to actually send that information, we will. Because it's also important that we collaborate with the entire healthcare ecosystem. So we believe at Kroger Health that health should be interdisciplinary. It should not be siloed, right? So we like the interdisciplinary multi-specialty approach where nurse practitioners, dietitians, pharmacists can collaborate with the greater ecosystem of specialists and PCPs in order to deliver great health care for our community.
I have a bonus question for you.
Sure.
And this literally just popped in my mind, but because I've encountered this a couple of times along the way. What is compounding, and are there any Kroger pharmacies that do compounding?
At this time, no. There are no Kroger pharmacies that do compounding, but the pharmacists are well aware of what compounding is. It's simply it's taking the active and the non-active ingredients that make up a medication or a drug, and then putting them together in a special way. And I'll give you a little bit of an example of maybe what you may have seen. So a pharmacist may ask, well, what kind of flavor would you want for this cough medicine? And they can actually add some flavoring into it. And that's adding some things. It's not creating a whole new, creating the active ingredients from scratch, but they have that capacity to, or actually that skill set to do that, but we don't do that today.
Okay. You could do, like Chris could do bourbon compounding. You would okay, and then one last question for you, because I remember seeing this before, and it particularly, I think, does impact some patients with cancer, but what about specialty? You have a few specialty pharmacies around the country. What is a specialty pharmacy, and how does someone, let's say, for example, if they need a drug that would typically be dispensed by a specialty pharmacy, can they get that from the Kroger system if that pharmacy is not in their area?
Yeah, so we operate a little more than 14 specialty pharmacies around the country, and a specialty pharmacy is thinking about that as medications that require extra touch.
Okay.
So there may be some authorizations and some complexity to the medication delivery.
Okay.
And we understand that many cancer patients have very, very specialized drugs. So if your cancer specialist is asking or requiring you to have some kind of medications, and that there is an opportunity for us to assist with that, the network designs that are in place from the payers and the insurance companies will direct them to the right spot. So we do that in conjunction with our specialty pharmacy around the country.
Gotcha. All right. Well, you guys are doing some really, really great stuff. And I think one of the, I think by having it so accessible and visible, I mean, I really do think it does. I mean, people are going to be inclined to do things because they're there and they can access it, as opposed to having to make a trip to a doctor. So I think it's a great kind of strategy that bridges things well. And I'm actually glad to hear that you guys don't want to see people just get over-reliant, because people do need to go get those other tests done that you can't have done at Kroger. So I think it's a great combination.
Thank you, Steve and Sherry. And we want to continue to complement the larger healthcare ecosystem. There's, I didn't say this, but if we look at where we are with disease and how much we spend on healthcare in this country, it's about $4.2 trillion.
My mind can't even wrap around that.
And we have 6 out of 10 folks who have at least one chronic disease, 4 out of 10 that have at least 2.
Okay.
So we're a sick nation. So there's a lot of opportunities for us to complement the existing system, but also fill in some of the gaps that exist.
All right. Well, thanks for all that you do. We're glad to have you here today. We'll look forward to having you back at some future time.
Would love it. Thank you.
All right. Thanks, Dr. Marc Watkins, Kroger Health, Chief Medical Officer. Thanks, everybody, for joining us, and we'll see you again soon.